Fundoplication is a surgical treatment available to treat severe gastro-oesophageal reflux disease, which we typically called as GORD. It is a keyhole surgery in which the stomach, top part of the stomach is used to wrap around the esophagus, which is the gullet, and this creates an extra barrier to stop the fluxing from the stomach into the gullet. Now, this surgery, the surgical treatment is reserved for patients who are refractory to medical management or in young patients in whom the prospect of medical management for life is not really viable. Fundoplication is not a major surgery. We do it keyhole, but it is still a big surgery. You are in overnight hospital and we discharge you the next day. There are certain things that you might not be able to eat immediately after the surgery, and hence you have a specific diet plan to get over it. But usually patients go home the next day. As fundoplication surgery is done laparoscopic, that is keyhole, it generally tends not to be very painful. You could have some referred pain to your shoulders, and that is usually due to the insufflation of gas that we use for any laparoscopic procedures. So in general, it is a long-term treatment for reflux disease. In majority of people, it will last for their life, but in 10 to 20% of the people will experience some recurrence of symptoms in maybe 5 or 10 years. In very minority of people, the symptoms can come back within a year. Very few patients need redo surgery for fundoplication, and most of the recurring symptoms can be treated with medical management. During fundoplication surgery, we use the stomach to create an extra barrier to stop refluxing of the acid from the stomach into the gullet. Now, this barrier can have an effect on the foods that you eat. Immediately after the fundoplication surgery, you might struggle with solid food, and hence we give you a diet plan which spans over a period of 6 weeks. Initially, you are on liquid food, then on mushy food, and then semi-solid food, then progress to solid food. Now, all patients do not need this strict six weeks regime, and you can progress through it as per your requirements. You generally, after 6 weeks, you're back to eating normally. However, certain foods will always be a problem, and that is bread and pasta, for which you might need to make it a bit moist in order to swallow it properly. So whenever I counsel patients regarding fundoplication surgery, I always go through this easy to understand model in which I explain that in 10 patients who have fundoplication surgery, generally speaking, 7 will say that all their reflux symptoms have disappeared and they have no side effects from the surgery. In 2 out of the 10 patients tell me that their reflux symptoms have disappeared. However, they might have some slight side effects from surgery, which will include some bloating, flatulence, which does ease over time, or slight difficulty swallowing certain kinds of food. And unfortunately, in 1 out of 10 patients, it doesn't work, and we don't know why. And hence, patient selection is crucial before undergoing fundoplication surgery. And hence, before we take the step for surgery, we have an extensive consultation wherein you understand the ins and outs of surgery along with its complications and side effects.